good evening to you all. Myself, Dr. Sumedha Gupta, and on behalf of Voice of Healthcare, I would like to welcome all the viewers who have joined us today. So, the topic of today's discussion is Heroes Fight for Health. Join the Prostate Cancer Awareness, and this initiative is supported by Zydus Life. Prostate cancer is a significant health concern in India, ranking as one of the most prevalent cancers among men. According to WHO data, prostate cancer accounts for approximately 7.7% of all cancer cases in Indian men, with an estimation of 1,05,000 new cases reported this year. Additionally, it is a leading cause of cancer related deaths with around 30,000 fatalities in 2020 alone. These statistics highlight the urgent need for enhanced early detection, prevention strategies, and treatment options to address the growing impact of prostate cancer in country. So, in this session, we are going to discuss and highlight the prostate cancer care by integrating physical, emotional, and psychological support. To begin with the discussion, first, I would like you all to join me in welcoming our expert who is going to provide us with insightful information on understanding about the prostate cancer awareness. So, I would like you all to please welcome Dr. Darshit Shah, Consultant Medical Oncologist, Haematology and Precision Oncology, Department of Medical Oncology, Sir H.N. Reliance Foundation Hospital and Research Center, ex-Assistant Professor, Tata Memorial Hospital, Mumbai. Good evening, Dr. Darshit. Welcome to the discussion.
Good evening, Sumedha ji. Thank you so much for your kind introduction.
Thank you so much, Dr. Darshit. So let's delve into the discussion. So, Dr. Darshit, if we talk about the awareness for the prostate cancer, can you please discuss the current state for prostate cancer awareness in India and the key areas where public education is needed for the same?
Correct. First of all, I would like to thank you for starting our discussion with the statistics. We can see that more than 1 lakh cases, more than 7.7%. It's an incidence rate. So people are not diagnosed with prostate cancer. They are usually diagnosed late. When we talk about India is a population of 140 billion, we have tier 1, tier 2 and tier 3 cities. So we have seen that the symptoms are neglected. The primary caregiver physicians, when the patients go to the local physician, they are also not keeping a diagnosis, or I would say a differential diagnosis of prostate cancer as a possibility. So usually we should always focus on the symptoms, reaching out to the primary care physicians, make getting a proper referral to a oncologist or a uro oncologist, then starting the treatment. So there are so many layers in which there are some loopholes, or I would say gaps. So that gaps needs to be addressed. They should be filled, and we can deliver it in a better way.
Thank you, Dr. Shah, for such insights. And I think you rightly said that these gaps have to be filled with proper care and under the proper guidance of the doctor. Moving ahead, if we talk about like what are some of the common misconceptions about prostate cancer that you frequently encounter while interacting with the patients, and how can we address these misunderstandings effectively? Either if we are treating patient in our tier one city or maybe in the remote areas as well, if we talk about the both aspects.
Correct. The commonly when I treat prostate cancer, or when I'm giving some sort of chemotherapy, or whenever there is need for hormonal therapy. So there are so many misconceptions when we start with the treatment. So the first misconception starts with diet. Is some dietary modification required? Is my diet the reason behind this prostate cancer, or will my dietary modification affect or change of the course of disease? Let's for say discuss about sugar. I mean, if I'm seeing 100 patients per day, 80% of the patients must have been told by some X, Y, or Z person that eating excess sugar increase your probability of cancer spread. So these are all the misconceptions regarding the treatment. Prostate cancer, they are always mimicking, like patient may have urinary urgency, hesitancy, or frequent micturition. They are sometimes diagnosed as having benign prostatic hyperplasia, that is BPH, because of old age problem.
Yeah.
It is not the same. There are many patients who are misdiagnosed as BPH, but when they eventually do their PSA levels, when we eventually biopsy them, they are diagnosed as prostate cancer. So this is how, we are just taking things lightly, I would say sometimes.
Thank you, Dr. Shah. And I think rightly you mentioned that differential diagnosis is really important to get the right treatment. And
I'm not able to hear you. Sorry.
am
Some
I
network
not
error is
audible to
there.
you? Am I not audible to you?
Are you able to hear me? Am I
Yes.
audible?
Am I audible now? Am I audible now, Dr. Shah? Am I audible?
Am I audible?
Yes, you are audible.
Just a second. I'll just rejoin. There must be some. I'm not able to hear you. Just a second. Sorry. Am I audible?
Yes, you are audible. Am I
Sure,
audible to
sure,
you?
sure. Yes, yes, yes. Sure.
So let's continue that. I think rightly said that the differential diagnosis is really important to get the right treatment. And you mentioned about the diet structures and about the dietary plans. So I would request you to please tell us or enlighten us about the maybe some dietary recommendation to the patient who are newly diagnosed with the prostate cancer or they are at the risk of it.
Correct. So for any cancer, usually the smoking, alcohol, they are all risk factors. If a patient is, doing those, I mean, smoking or alcohol, it is very strictly recommended to stop it. Second comes to dietary things. They are, supposed to follow normal, healthy, hygienic diet. If a patient, for example, is on chemotherapy, and if he or she, if he, sorry, not she now, so if he is not taking diet properly, it when it leads to weight loss, and it actually can impact the chemotherapy sessions. The patients may have more side effects of chemotherapy if the patient is persistently having low nutrition, uh, persistent weight loss, so that has an impact on diet. But as such, there are no dietary specific restrictions to follow when the patients are on chemotherapy or when they're diagnosed with prostate cancer.
Thank you, Dr. Darshit, for these insights. Moving ahead to this, how important it is for men to be proactive about their prostate health and what steps can they take to stay informed and engage about it?
Correct. So, first of all, I would also like to mention a point that prostate cancer also has some hereditary preponderance. So, if your, like BRCA genes, if you are aware or if the audience is aware or not, genes are the genes which, they have hereditary preponderance, like breast cancers, ovarian cancer, prostate cancer. When a person is having significant history of these cancers, it is always recommended to get a germline BRCA testing. You have to test for BRCA mutations. This you should be aware. If I mean, today only there was a patient who had a significant history of eight cancer patients in same family, either maternal or paternal side. Those patients are recommended to get a BRCA assessment panel done. Apart from this, if you are having persistent urinary incontinence, urgency, feeling that urge to micturate, when you are elderly, or if the patient is having back pain, sometimes the patients are not diagnosed early, they are having diagnosed in a later stage when the patient are having back pain or any bony pain. It may also suggest that the cancer has spread beyond the prostate, and when we evaluate, when we do a PSMA PET scan, the patients are having cancer of prostate with extensive metastatic in the bone. So all these things you should always evaluate. Like a normal person would not have continuously bones pains or back pain or pain at night. So all these symptoms suggest something is going wrong.
Thank you, Dr. Shah, for insights on these. And I think this is really insightful for the patient who are seeking and watching this. Moving ahead, could you please explain the significance of personalized treatment plans in prostate cancer care, maybe physically, emotionally, or psychology, and how they are tailored to individual patient needs?
Correct. So, very, very important question. As a medical oncologist, what I would be, more focus is giving chemotherapies, giving hormonal therapies, or, but there is a lot beyond this. There is navigation, there is psychological aspects involved of the patient, of the family, of the caretakers. There's always a financial aspects involved. So there are we have team here. We have a psychological counselor who, patients are, when somebody is diagnosed with cancer, it's not so easy for them to understand that the things are not going to be same as it was previously. So the psychological counseling is very important. The dietary counseling is also very important. The financial counseling also very important. From medical oncology perspective, we start the chemotherapy and we have a very good team of nurses and all these departments who takes care of this supportive and the ancillary supports.
Thank you, Dr. Shah, for insights. Moving ahead, what are your suggestions onto that? That what role do the regular follow-up visits play in managing prostate cancer, and what should patient expect during these appointments?
Correct. So when a patient, usually when we talk about metastatic prostate cancer, or when they are on tablets like abiraterone or something, they are expected to follow up every 3 monthly. We always see the rise of PSA. The trend of PSA is very important for us to determine the course of disease. So, for example, a PSA is 2, suddenly it jumps to 20 or 30. Then we have antennas up that something is going wrong. So then we have to evaluate them properly, like and we do scans and everything, and when we are able to diagnose early. Some patients, when they are cured of disease, they are not following up very frequently or regularly, thinking that the things are going to be normal. But sometimes the patients do progress once they are treated. So that is very important. The regular follow-ups, as advised by doctors, are very important.
Yes, very rightly said. I think regular follow ups is really important for the ongoing treatment and what exactly is going on with their bodies inside. And I think it really changes after every session, every visits. Moving ahead, in addition to the conventional treatment, if we talk about, are there any complementary therapies that can support prostate cancer patients, and how can they be integrated into the patient's overall treatment plan and for their well being?
Correct. So, definitely there are some complementary, the supplements, like if the patient is very frail, like protein supplements and everything, they also play a role. I would personally not, I'm not very keen in, when somebody asks about Ayurvedic support or, homeopathy supplement, because I'm not aware of those contents. But yes, the supplements in terms of high protein diet, some protein powder, everything definitely helps to build the albumin levels, build the protein level, and the patients are able to tolerate the treatment well.
Thank you, Dr. Shah, for this. Moving ahead, how does the holistic approach to the prostate cancer can address the physical, emotional, and psychological need of a patient, and how patient can do this onto their own level? What are your insights onto that?
Correct. When they are diagnosed and after 6 months, they tend to understand how to, how to take care of themselves. What are the warning signs, you should look for, and all the teams like neurosurgeons, medical, radiation oncologists, and every team we always work together. We have also a tumor board here, so we decide the plan, and the patient has to just follow that. If you are having this symptom, if you are having that symptom, it can be because of side effect of the drugs, of chemotherapy, of progression of disease. The dietary team, the counseling team, every the team is aligned that it is for the betterment of the patient, and the patient has to follow what has been prescribed and written.
Thank you, Dr. Shah, for this. I would like to extend this question to more like how do you think that multidisciplinary approach can work best for the prostate cancer patients?
Definitely, a multidisciplinary approach always works best for the patient, because, for example, me and Dr. Sumedha, we are together. My thought process for a patient might be different, and your thought process of thinking and going forward for the patient might be different. So, when three or four experts in that domain sit in the room, discuss for a single patient what is the best data, what how we can proceed forward, what for the patients in the best interest of the patient, that is always going to help, rather than me deciding everything in terms of surgery, radiation, chemotherapy, nutrition. It's not going to help. I always require a support of all the experts for a single patient. In that way we always perform well when we have multiple opinions and multidisciplinary teams.
Thank you, Dr. Shah, for insights. I would request you to please discuss the importance of involving family and caregivers in the holistic care of prostate cancer patients and how can they contribute to the overall well-being of the patient.
Correct. So family does play a very important role. When we talk about prostate cancer, definitely it plays. But when we talk about any cancer, a family and a caregiver's role is very important. It's not so easy doing this blood test, coming to hospitals frequently, doing this scans. They're taking care of the medicines at right time, right durations, managing these complications, looking for the warning signs. All these aspects a patient cannot do himself. He needs a support. Patient's wife, the children, or sometimes a caregiver has to be the main navigator. When prostate cancer patients usually are elderly, they do have multiple problems apart from prostate cancer. Some may have dementia, or some other neurological deficits, so they are not very well versed or aware of taking medicines at right time, or looking for all these things which I discussed, the warning signs. So the patient's caregiver role is very important. Sometimes they're also, I would say, distressed because of so much of on them. So yeah, we also need to look on their psychological aspects of caregiver.
Very rightly said. And I think these patients of particular age group like geriatrics patient are really get affected by that and they are already very vulnerable. So I think caregiving by their family is also really important in terms of their overall well-being and treatment. Moving ahead to the patient advocacy, what role do the patient advocacy groups play in improving the quality of care for prostate cancer patients, and how can individual get involved in these organizations and get the whole benefit and whole treatment from them?
Correct. So patient advocacy groups definitely are very important. They are the existing patients also. There are some patients who have gone through the journey of treatment, who understand what it takes to go through the journey, taking chemotherapies or getting a surgery done. So they are the best to discuss their experiences, to help navigate the patients better. In my OPD, some patients may take 30 minutes, some patients take 40 minutes, but they do have a lot of questions which they feel that they cannot ask the doctors. It's very, it is not a good thing. So these navigators, these advocacy groups, they play a very major role to build an ecosystem that patients can share their experiences, their problems, their treatments, their outcomes, and learn from each other's experiences, so that it helps each one of them.
Very rightly said, Dr. Darshit, and I think this also support their morale for their own well-being and for going with the treatment.
Correct.
Moving ahead, how can patient advocate for themselves within the healthcare system to ensure they receive comprehensive and compensate care for each and every part or maybe lifestyle they are having that time in that duration?
So patient advocate, you are talking about patient advocate getting the treatment. Can you come
Patients
again, please?
getting patient getting supports from them.
Patient getting support from them. Okay. So my background is from Tata Memorial. I have worked in Tata Memorial for 6.5 years, and we have dedicated advocacy teams. Who provides emotional support. There are so many patients who are there themselves. There are many patients who are scared of chemotherapy. Okay, chemotherapy leads to so and so complications. It's a dreadful thing. So let me tell each one of you dread we should be feared of cancer, not for chemotherapy. Chemotherapy is there to cure, to control the disease. We should always fear of cancer, but there has been some myth and misconceptions among the patient that chemotherapy से पेन होता है, कीमोथेरेपी से जलन होता है, कीमोथेरेपी से जान चली जाती है. They are all misconceptions. Yes, it can happen, but it's extremely rare. So the advocacy groups, they actually help the patients understand what they have gone through. Plus they also provide some financial support. There are so many schemes, run by governments. There are so many NGOs who are there to help the patient, but we need to find a mediator who connects those patients who are in need to the donor. So this is how a patient advocacy group needs to play. They are playing their role. They need to scale up these roles.
Thank you, Dr. Shah, for these insights. Moving ahead with the discussion, can you please brief us about the latest advancement in the prostate cancer research and how these could improve the patient outcomes?
Correct. So now when we talk about the carcinoma prostate, it is not that aggressive. I mean, prostate cancer is usually a disease of elderly, but we have so many treatment options now. We have so many research molecule. When we talk, we go into deep diving into precision oncology. We are finding the mutations. We are doing the next generation sequencing. We are targeting those mutations. We are testing for the NGS. We are identifying like BRCA genes or HRR genes. We have specific targeted therapies like olaparib for them, which has shown dramatic results and has tremendous role, in prostate cancer. So from the days of chemotherapies to hormonal therapies, more moving towards targeted therapies. We do have roles of immunotherapies like pembrolizumab. So the prostate cancer treatment is coming, has been in a very long journey. It has evolved leaps and bounds.
Thank you, Dr. Shah, for such insights. And I think this is very enlightening to know about these research and latest development for the prostate cancer care. Moving ahead with the discussion, I would request you to please tell us like what are some of the lifestyle changes or complementary therapies that can support prostate cancer treatment and overall well-being.
Please exercise regularly, avoid smoking, alcohol. You should have proper sleep. This is has been taught for every diseases, like proper sleep, avoid smoking, alcohol. But it some way or the other it is not reaching the masses. So for prostate cancer specifically, please exercise and lose weight, and all these addictions and everything you try to stop if you are already addicted to. So this is my message to all the viewers.
Thank you, Dr. Shah, for the insights. Moving ahead, since we talked about the treatment, we talk about the complementary therapies. What are your insights on the most common side effects of the current prostate cancer treatments, and what strategies can patient use to manage these side effects very effectively?
So, usually when we talk about the hormonal tablets like enzalutamide or abiraterone, the side effects are not that significant. They may have weight gains, they may have, deranged lipid profiles, but some problems in the, the heart issues. But usually the tablets, the hormonal tablets are usually very well tolerated. When we talk about chemotherapy, The commonly chemotherapy drugs which we are using is docetaxel or cabazitaxel. It may lead to hair loss, it may lead to weakness, fatigue, or diarrhea, or sometimes low WBC, which may predispose to infection. So these are the common side effects. If the patients are on chemotherapy, they should be looking for, and they should reach their doctor immediately.
Very rightly said, Dr. Shah. In the end, to conclude, what recommendations do you have for improving patient education and awareness about prostate cancer, especially for those who are newly diagnosed with this and who are at the risk of this disease?
Correct. So, in terms of if the patients are newly diagnosed, I will strongly recommend please take treatment, whatever your doctor is suggesting. uh, if the patient is just in the evaluation phase, please go to a neurosurgeon, oncologist, to, if there is any suspicion of cancer, get your PSA done very frequently. If the PSA values are high, you should be going undergoing a biopsy to prove or disprove it. Not every time the biopsy will be showing cancer, but if it shows cancer, we have to treat it. Correct. So this is my message to all.
Very rightly said, Dr. Darshit. Thank you for the insights. So, in conclusion, our objective for today's discussion was to explore and emphasize the importance of holistic prostate cancer care by integrating physical, emotional, and psychological support. And I'm confident that our experts have addressed this topic comprehensively and effectively, presenting the information in a manner that is both thorough and accessible. I would like to extend my sincere gratitude to Dr. Shah for his insightful contribution and for sharing his expertise with us. Your participation has been valuable, and we deeply appreciate the time and knowledge that you have shared. Thank you for joining us today. Thank you so
Thank you, Dr.
much.
Sumedha. Thank you for having me. Thank you so much.